EduHealth is comprehensive. It is all inclusive. They're from development to implementation, problem solving. The team is there for your team of nurses. I've never had an issue with that. It saves time. It's flexible. I can put nurses where I need them to go, and they still have everything they need for the day. That's on my end. We don't have to keep physical charts anymore when you have a school with 1,800 students in it. You have to find physical space for that. And then to go through, do you have it as freshman, sophomore, junior, senior, they move grades. Now we just pull it up by their number, their name, and it's there. The nurse's chart, it's legible, it's quick, it's efficient, and I know it's right there and can be pulled up instantly if something happens later on that day. The EduHealth dashboard, as soon as the nurse opens up her computer, her day is right there. She knows instantly her medicines, her treatments, what time they are, what they are, who's coming. She knows what she needs to do as far as refills. And if I have a nurse who calls in, I can send another nurse to that building. I go in and I assign her to that dashboard. That nurse knows exactly what she has to do for all those kids. Her name's going to pre-populate on the medications that she gives, everything. It is done. With reporting, we had to keep literally those big notebooks of paper. I would have, here's my confidential health list for this grade. Here's that grade. Immunizations, we kept cards out on our desk with little tabs on them. It was very cumbersome. It was in your face. Your desk was all over the place. With EduHealth, if we need a report run, we just let Nuvento know this is what I need the report on. They figure out the data to pull for us, and that part is pulled out, and we have our information. We can sort it as we need it. We can make our confidential health list for each teacher or grade, so that we know who has allergies, who has previous surgeries, or whatever we need to know. I think it looks very intimidating when they first look at it, like, oh my gosh, all these things. And I'm like, this is exactly like the chart that you use in the hospital, exactly like we used in clinical, only it's all on the computer. This is everything we're currently doing is on the top part. Everything else that you flip through to find in the chart is down below. Screenings, health forums, medical history. So what you're doing now is here. What you want to look up in the past or look and review and reference is down here. And once you explain it that way, they're like, oh, and then they just fly right through. Before we had the bulk scanner, we had to stand at the scan machine and enter it into our email, scan it in, label it, then go pull it in and upload it, several steps. And the bulk scanner saves so much time and energy, and it is all right there. The EduHealth team has been beyond helpful. I've had representatives come out, meet with us on site to look at what we see, coming out and seeing it, working with us. We've had Teams meetings with the developers from other parts of the world, and they all get on and they work together.